The blood pressure tea protocol. Every single morning, millions of people wake up, boil some water, drop in a tea bag, and go about their day thinking they've done something good for themselves. And maybe they have. But here's what nobody is telling you. The tea you're already drinking could be doing 10 times more work for your blood pressure, and the difference between what you're doing right now and what actually moves the needle comes down to 5 simple things you add to the cup. Not pills, not expensive supplements, not some powder you order online that takes 3 weeks to arrive. Things from your kitchen, things that cost pennies, things you could add to your very next cup. And when you understand why they work, not just that they work, but the actual science behind what's happening inside your blood vessels, you're going to wonder why nobody explained this to you sooner. Here's what makes this conversation different. Most people think high blood pressure is one problem, one number that's too high, one medication to bring it down, one simple fix. But the truth is that high blood pressure is actually 5 separate problems happening inside your body at the same time, and that's exactly why so many people stay stuck. You take your medication, it handles 1 or maybe 2 of those problems, and the other 3 just keep pushing that number right back up. The 5 additions I'm going to walk you through today target every single one of those 5 problems through completely different mechanisms. By the end of this, you'll understand your own cardiovascular system better than most people who have been on blood pressure medication for 2 decades. Before we get into the additions, I need to take 60 seconds to lay out those 5 problems, because once you understand them, everything else clicks into place. Problem 1 is arterial stiffness. After 60, the elastic fibers in your artery walls break down and get replaced by stiff collagen. Your arteries stop stretching with each heartbeat the way they're supposed to, and all that pressure has nowhere to go except straight into your blood pressure reading. Problem 2 is narrowed blood vessels. Your body isn't producing enough nitric oxide, the molecule that tells your artery walls to relax and open up. Less nitric oxide means tighter vessels and higher pressure. Problem 3 is thick blood. Blood viscosity increases with age, and thicker blood simply requires more force to push through the same pathways. Problem 4 is sodium overload. Your kidneys are holding on to too much sodium, pulling extra water into your bloodstream and increasing the volume of blood your heart has to push. Problem 5 is a nervous system stuck in overdrive. Your fight or flight system becomes chronically activated as you age, keeping your heart rate up and your vessels constricted even when you're just sitting in your living room doing nothing stressful at all. 5 problems, 5 mechanisms. Now let's fix them one by one. We're starting with addition number 5, and that's fresh ginger. Ginger belongs in your cup every single day, and the reason why goes much deeper than most people realize. Inside fresh ginger, there's a compound called 6-gingerol, and this compound does something remarkable. It works through 2 completely separate pathways that just happen to mirror the 2 most commonly prescribed classes of blood pressure medication. The first pathway involves an enzyme called angiotensin converting enzyme, which is the exact same target as ACE inhibitors like lisinopril. That enzyme converts a relatively harmless molecule into angiotensin II, which is a powerful constrictor that tightens your blood vessels and also tells the artery walls to produce more of the stiff collagen that makes them rigid. Ginger blocks that enzyme, reducing the angiotensin II signal, allowing your vessels to relax and slowing the progression of arterial stiffness over time. A study published in the journal Phytotherapy Research found that ginger supplementation reduced systolic blood pressure by about 6 millimeters of mercury and diastolic by 4, which is genuinely comparable to what a low-dose ACE inhibitor produces, and without the chronic dry cough that sends so many patients looking for alternatives. The second way ginger works is through calcium channel blockade, which is the mechanism behind another entire class of blood pressure drugs, including amlodipine. Calcium entering the smooth muscle cells of your artery walls triggers those cells to contract and the vessel to narrow. When calcium is blocked from entering, the muscles stay relaxed, the vessel stays open, and pressure drops. A study in the journal Vascular Pharmacology showed that ginger compounds produced dose-dependent relaxation of arterial smooth muscle through exactly this mechanism, and crucially, the 2 effects were additive, meaning the ACE inhibition and the calcium channel blockade work together rather than duplicating each other. You're getting two pharmaceutical mechanisms from one ingredient you can grate from a root that costs $1.50. To use it, grate about 1 inch of fresh ginger directly into your cup before adding hot water and steep it for at least 5 minutes. Fresh ginger is significantly more potent than the dried powder because the active compound begins to degrade once the root is cut and dried, though a 1/4 teaspoon of good quality powder works if fresh isn't available. Now we move to edition number 4, and this one has some of the most impressive clinical evidence of anything in this entire protocol: hibiscus petals. Specifically the deep red dried petals of Hibiscus sabdariffa, which you might know from herbal teas or from the drink called Jamaica in Latin American communities. Hibiscus works primarily on the nitric oxide pathway, which is the one your ginger doesn't fully address. Remember that nitric oxide is the master relaxation signal for your blood vessels, and after 60, the endothelial cells lining your arteries become damaged by decades of oxidative stress and start producing far less of it. What little nitric oxide they do produce often gets destroyed almost immediately by a reactive oxygen species before it ever reaches the smooth muscle cells it's meant to relax. Hibiscus attacks this problem from both ends at once. The anthocyanins in hibiscus, particularly a compound called delphinidin, stimulate the enzyme that produces nitric oxide while simultaneously scavenging the free radicals that would destroy it. You get more production and less destruction at the same time. The results in clinical trials are striking. A meta-analysis published in the Journal of Hypertension reviewed multiple randomized controlled trials and found an average reduction of 7.5 millimeters of mercury systolic and 3.5 diastolic from hibiscus tea alone. Some individual studies saw reductions as high as 13 millimeters systolic. To give you a frame of reference, a 10 millimeter reduction in systolic blood pressure is associated with roughly a 20% drop in cardiovascular event risk. That is not a minor effect. One head-to-head trial published in Phytotherapia actually compared hibiscus tea directly against the ACE inhibitor captopril and found that the hibiscus group achieved blood pressure reductions that were statistically no different from the drug group with fewer side effects. But here's what really separates hibiscus from most interventions, both natural and pharmaceutical. Over time, it doesn't just temporarily force your vessels open. The polyphenols in hibiscus actually repair the endothelial cells themselves, rebuilding their capacity to produce nitric oxide on their own. A study in atherosclerosis found a 20% improvement in flow-mediated dilation after 8 weeks of daily hibiscus consumption. The longer you use it, the better it works, because the underlying vascular health is genuinely improving. Addition number 3 is cinnamon, and the mechanism here is one that most people have never heard explained, even though it may be driving their blood pressure more than anything else. After 60, nearly everyone develops some degree of insulin resistance. The cells don't respond efficiently to insulin, so the pancreas compensates by producing more of it, leading to chronically elevated insulin levels throughout the day. Here's what most people don't realize. Insulin directly tells the kidneys to hold on to sodium. The higher your insulin levels, the more sodium your kidneys retain, and the more water follows that sodium into your bloodstream, expanding blood volume and raising pressure. This isn't a theory. A study in the New England Journal of Medicine showed that direct insulin infusion increased kidney sodium reabsorption in healthy subjects within hours in a dose-dependent way. For someone with insulin resistance, this isn't happening occasionally. It's happening every hour of every day, and it's keeping their blood pressure elevated around the clock regardless of how much salt they eat. Ceylon cinnamon contains a compound called methyl hydroxychalcone polymer that improves insulin sensitivity directly. When your cells respond better to insulin, the pancreas produces less of it, and with lower insulin levels, the kidneys finally get a weaker sodium retention signal. They start releasing sodium, water follows, blood volume drops, and so does pressure. A meta-analysis in clinical nutrition found average reductions of 5.4 millimeters systolic and 2.6 diastolic from cinnamon supplementation across 9 randomized trials. But cinnamon brings a second mechanism that's completely independent of insulin. Cinnamaldehyde, the compound that gives cinnamon its familiar flavor, stimulates nitric oxide production in endothelial cells through a calcium signaling pathway that is distinct from the one hibiscus uses. Cinnamon also reduces blood viscosity by inhibiting platelet aggregation and lowering fibrinogen levels, according to research in the journal Thrombosis Research. So cinnamon addresses sodium retention, nitric oxide production, and blood thickness through 3 separate pathways. 1/4 to 1/2 teaspoon stirred into your tea is enough, but make sure you use Ceylon cinnamon specifically, not cassia. Cassia contains high levels of coumarin that can damage the liver with daily use. Ceylon is safe for daily consumption, and the label should say either Ceylon cinnamon or Cinnamon verum. Addition number 4 is lemon juice, and its most important role in this protocol involves something most blood pressure conversations almost completely ignore: the potassium to sodium ratio. Your kidneys don't just respond to how much sodium you eat, they respond to the balance between sodium and potassium. Potassium is the signal that tells the kidneys to release sodium and water. When potassium is high relative to sodium, blood volume goes down, and so does pressure. The problem is that the modern Western diet provides roughly 3,400 milligrams of sodium daily, but only about 2,500 milligrams of potassium. Our ancestors, the diet our kidneys actually evolved for, had the ratio almost completely reversed: 500 milligrams of sodium and over 10,000 milligrams of potassium. We've flipped this balance so completely that our kidneys are permanently stuck in sodium retention mode. The juice of 1 lemon provides about 116 milligrams of potassium, and across 2 to 3 cups of tea per day, that cumulative contribution starts to matter. But there's more going on with lemon than just potassium. Lemon juice contains citric acid that your body metabolizes into bicarbonate, which has an alkalizing effect on the blood. This matters because the typical Western diet, heavy in animal protein, processed food and grains, creates a chronic mild acid load that the kidneys are always working to neutralize, and while they're busy excreting acid, they're retaining sodium. By providing bicarbonate, lemon juice frees up kidney capacity for sodium excretion. A study in hypertension research found that urinary pH, which reflects your body's acid-base balance, was inversely correlated with blood pressure in older adults. More alkaline equaled lower pressure. Lemon also supplies vitamin C, which both supports nitric oxide production and protects existing nitric oxide from oxidative destruction, adding yet another mechanism to an already layered protocol. Squeeze the juice of half a lemon into your tea after it's cooled below boiling temperature. Adding it to scalding hot water degrades the vitamin C and the flavonoids before they can do their work. And now we arrive at addition number 1, the one that completes this entire system by addressing the one mechanism none of the other 4 fully handle: raw honey. 1 teaspoon. I know what you're thinking. Honey is sugar. And you're right, it is. But 1 teaspoon contains about 5 grams of carbohydrate, and in the context of a full cup of tea with all these other ingredients, the glycemic impact is genuinely negligible. What matters is what that teaspoon contains that no other addition on this list does. Raw, unprocessed, unheated honey contains a suite of flavonoids, including chrysin and pinosembrin, that directly address the 5th and most stubborn driver of high blood pressure after 60, an overactive sympathetic nervous system. Remember that the fight-or-flight system becomes chronically activated with age, keeping blood vessels constricted and heart rate elevated even at rest. This is the hidden driver behind resistant hypertension, the kind that doesn't respond fully to medication no matter what you try. Chrysin, one of the flavonoids found in raw honey, modulates the GABA receptor system in the brain. GABA is the primary inhibitory neurotransmitter, the brain's natural calm-down signal, and the same receptor system targeted by anti-anxiety medications like diazepam. But unlike pharmaceutical benzodiazepines, chrysin produces a gentle enhancement of GABA signaling that calms the nervous system without causing sedation, cognitive fog, or dependency. A study in pharmacology, biochemistry and behavior found that chrysin produced significant anxiety-reducing effects through GABA receptor activity with measurable reductions in heart rate and blood pressure. Pinosembrin, another honey-specific flavonoid, works through a different pathway, reducing cortisol production and sympathetic nerve activity directly. Research in the European Journal of Pharmacology confirmed that pinosembrin decreased stress hormone output and dampened sympathetic nerve signaling in models of chronic stress. Together, these two compounds address the central nervous system driver of hypertension in a way that no vegetable, spice, or citrus fruit can. They're calming the command center that's been keeping your blood vessels locked in a state of chronic constriction. The quality of the honey matters enormously here, and this is where most people go wrong. That clear, perfectly golden, pourable honey you find at most grocery stores has been heated and ultra-filtered to the point where the chrysin and pinosembrin, along with most of the other beneficial enzymes and compounds, have been almost entirely destroyed. What you need is raw, unfiltered honey, the kind that's cloudy, thick, sometimes crystallized, and may contain visible pollen granules. That cloudiness and thickness is the sign that the bioactive compounds are still intact. Look for labels that say both raw and unfiltered. Local honey from a farmer's market or beekeeper is ideal. Manuka honey contains even higher concentrations of certain phenolic compounds if you're willing to spend more, but any genuine raw honey provides meaningful levels of chrysin and pinosembrin. Add it to your tea only after the liquid has cooled to a comfortable drinking temperature, because heat above about 40 degrees Celsius begins destroying the heat-sensitive enzymes and flavonoids that make raw honey special. 1 teaspoon, stirred in gently, not a tablespoon, not a generous pour. Here is the complete picture of what you're doing when you combine all 5 additions in 1 cup. Your ginger is inhibiting the enzyme that stiffens arteries and blocking calcium channels to relax vessel walls. Your hibiscus is flooding your endothelium with nitric oxide stimulus and gently nudging excess sodium out through the kidneys. Your cinnamon is dialing down the insulin-driven sodium retention that may have been silently inflating your blood volume for years, while also stimulating a separate nitric oxide pathway and reducing blood thickness. Your lemon is correcting the acid-base imbalance that's been tying up your kidneys, adding potassium to tip the fluid balance, and protecting the nitric oxide everyone else is working so hard to produce. And your raw honey is finally addressing the nervous system overdrive that's been keeping everything chronically contracted, while also quietly adding a 4th nitric oxide signal through a completely different route. 5 problems. 5 additions. Every mechanism covered, many of them addressed by multiple ingredients simultaneously, reinforcing each other in ways that no single medication could replicate. The recipe is simple. Start with green tea as your base, if possible, because it adds its own blood pressure benefits through catechins that suppress a key source of oxidative stress in your endothelial cells. Grate 1 inch of fresh ginger directly into your cup. Add 1 tablespoon of dried hibiscus petals and 1/4 teaspoon of Ceylon cinnamon. Pour your hot water over all 3 and let it steep for 10 to 15 minutes. That long steep matters because the hibiscus anthocyanins release slowly and a short steep leaves most of them behind. After steeping, let the tea cool until it's comfortable to drink, then add the juice of half a lemon and stir in 1 teaspoon of raw honey. Drink this 2 to 3 times a day, morning, afternoon, and evening. The evening cup is especially important because the nervous system calming from the honey and the vasodilation from the ginger and hibiscus work while you're sleeping, helping restore the natural overnight blood pressure dip that protects your heart and kidneys. The entire month's supply of all 5 additions costs somewhere between $10 and $15. That is the full protocol. That is every mechanism. Start today.